Hello, everybody.
So we've been off for the last 2 weeks because I'm kind of embarrassed about it. But the FCC, they kind of called and started threatening us because we talked about too much poop last time, and they said it was a shitty conversation. So apparently, the man doesn't want us to know about poop. So today we're going to talk about inflammation. And somehow we're going to fit poop into this? No. So like half poop, half inflammation?
No.
Real poop, placebo inflammation? No? Alright. So, all inflammation?
All inflammation.
Alright. So we're going to talk only about inflammation and how it relates to poop. No? Alright. Fine. We'll only talk about inflammation. As you know, the show is called Dr. G and the...
Boss.
See? Wasn't it Bossy? Dr. G and the Bossy?
Bossy could be also be applicable.
Bossy means... what do they call it? Authoritarian? Alright, so we're going to talk about inflammation. And you had some questions. So I'm Dr. G, this is Holly Hajaj.
One day.
Hajaj.
One day he'll get
Hajaj.
it right. So my name is Holly Hajaj.
Hey, that's pretty good.
And I just recently became the corporate wellness director at the YMCA.
Nice.
We go out and partner with companies in the community to create wellness programs for their companies. I think our corporate culture probably needs some of that.
Yes.
So.
So that's crazy. So that like cuts down on their cost, right?
Oh yeah.
Because a bunch of so like General Motors, they went bankrupt because they could not afford to employ a sick, fat population, but yet they created a situation where their employees would be sick and fat, which is messed up.
Yeah, and it's not necessarily about reducing costs for companies. It's also about making people feel better and taking care of people in general at work. So.
And that makes them more productive.
Right. And happy.
Nice. So basically what she does is she just goes to the company and knocks over the vending machines and, is that right? And screams at people.
Uh-huh.
No, that would be the Dr. G way. Alright, so that's awesome. So you're corporate, so then I feel like I'm just LLC, so I don't know. Alright, so what do you guys have questions about with inflammation? So lots of people have said we should talk about inflammation and pain, and by a lot of people I mean Jenny Robinson. So, so what do you guys want to talk about when it comes to pain and inflammation? And I guess one of the questions first would be, is inflammation good or is inflammation bad? What do you think? Or should we... You guys know? What are you doing? Are you playing Tetris?
Yeah, I'm sharing our talk.
She's playing Tetris over here. Mm-hmm. Corporate Tetris. So is inflammation good or is it bad?
Go ahead and type that in.
Oh, you're not going to answer us?
I'm not going to answer. I'm going to let someone else answer.
Okay. So did they? Hey, Chiaru. She's in Japan. Chiaru, I heard there was an island off of Japan that we didn't visit that has bunnies on there. Like it's like a plague of bunnies, and you just go lay down and bunnies cover you and stuff. I kind of want to go there next time. So anyways, with inflammation, so some inflammation is good and some inflammation is bad. And basically the way it works is if you have little bits of inflammation from time to time, that's really good. So it should be short-lived, and that makes us bigger, faster, stronger, Can you hit invite on here? Is it on there? So, short-term inflammation
She's joined.
would be really good. But long-term or chronic inflammation would be really bad. And that's where we really come into problems with, is the chronic inflammation. And the statistic that's really important about this is that in America, what is it? 3 out of every 4 Americans is now chronically managing a chronic inflammatory disease. 3 out of every 4. And the other, I think, fourth are just young guys who refuse to do anything to help themselves. So it might be 100%. It's hard to tell. But 3 out of 4, that's crazy. Especially when you look at how easy it is to knock down inflammation, reverse that stuff. And you know, when you look at diet and lifestyle kind of stuff, we want to see more of like, what are we doing to cause that? And less, what can we do to reverse it? Now, in the beginning, we want that little flip-flop there because we want people out of pain and out of inflammation as quick as possible. And then we want to make sure that they don't get it back, or, you know, that they don't have chronic knee pain and chronic shoulder pain, chronic headaches. But there's other inflammatory things that we've got to worry about that are sometimes even worse.
Mm-hmm.
Like what? You know? You want to ask them.
Like your co-host.
I am inflammatory. Are you talking about you or me?
I'm talking about you.
I'm the pain. She's the inflammation. So, what about heart disease? So heart disease is 1 out of every 2 Americans can expect to have a risk of heart disease in the U.S., which is up 18 times than it was, say, 50, 100 years ago. And so, you know, heart attack, stroke. What's crazy is more women now have heart disease than men. And so that means you're at a higher risk of stroke or a higher risk of heart attack being female. And that's like, we have to rewrite medical textbooks. We have to train physicians differently. So why is that? What do you think about, like, why do women have more heart disease?
I think in past talks we've discussed them having hormonal differences.
Yes.
So.
Hysteria.
Mm-hmm.
The uterus makes you have more heart attacks. No, wait. Women have always had uteruses. Or uteris? I think it's uteris. The uterus in a man is a prostate. Did you know that?
I did.
Yeah. All right, then.
Mm-hmm.
That's where the baby lives in a guy. It's in the prostate.
Right.
And then it goes full term, it delivers little people. So, Verskow, who was the physician philosopher back about 100 years ago, he said all disease is inflammation. And if we fast forward to today, it's just, all the research says the same thing. All disease is inflammation. So heart disease is a big one because that's a pretty fast way to end it all. In fact, 40% of all heart attacks are at 4 a.m., which is interesting because that's when your cortisol peaks the highest. So pretty much when you're talking about inflammation, you're talking about all disease at that point. And so for some people, though, it's that chronic repetitive damage, like some guy that works at the mill and he's constantly has to pull a lever back and forth all the time. So that person might end up with shoulder problems, or somebody has to turn something all the time. That kind of repetitive injury causes damage. Cardiovascular-wise, it's a lot of chemicals that are produced that then cause inflammation and damage, which is short-term, it's not so bad. Food sensitivities, bacterial viruses, even like certain bacteria you can get infected, like strep verde. Yeah, that one could actually go and infect your heart and cause inflammation there, and actually make little friable lesions that then end up causing strokes and heart attacks that way. And chronic fatigue, fibromyalgia. Those kind of things often start with like cytomegalovirus, and so this chronic, prolonged inflammatory condition. Lots of chemicals. And they call it PM 2.5 is the term. And so, like, next door, they're destroying a building. The old Star Telegram. No. What's it called? Star Telegram? What's the Wichita paper?
Eagle.
All right, I was thinking Texas. All right, Wichita Eagle. Their building next door is being torn down, and I got to watch it today a little bit. But all this stuff is going through the air, so like even just standing there for a little bit, I had grit everywhere. But if the molecules are 2.5 micrometers or less, they can basically embed into the lungs, and then it takes a very long inflammatory process to try to get those out, and then people end up in chronic inflammatory lung disease and often lung cancer because of that, especially carbon fibers. Those are really bad too, like carbon fiber. Bikes and tennis rackets, if they explode, those fibers can get in there and it'll cause the same problem as like asbestos does. So then you have autoimmune stuff. So a lot of people have that. So rheumatoid arthritis would be the obvious thing. But then also things like migraines are inflammatory for a lot of people. All the IgG food sensitivities, they cause a lot of histamines. Those histamines, they overload and then go and damage tissue or cause chronic inflammatory components, depending on whether it's H1, H2, H3, H4, or you're H2. You cause migraines. Did you know that?
I'm very well aware.
All right.
I just wanted to jump in here and say hi, Brandy. Hi, Brianna. Hi, Jeffrey. Good to see you on here. Thank you, all of you who are joining us tonight. Do you have...
Wait.
What kind of...
Did Jeffrey just say hi, Holly, and that's it? No. Am I in frame? Do I exist? She doesn't even care? No. Is mine on there? Nobody cares. Nobody cares.
So what kind of inflammation, you joined this talk tonight. I'm showing 13 people right now watching this talk. What kind of inflammation are you wanting to learn about tonight? How did you hear about it? Do you have it in your own life? Are you experiencing inflammation? And if you are, what type? Like, is it joint pain? Is it you went to the doctor and you found out you had something going wrong, cardiovascular-wise? Or what is it that concerns you the most? Can you please share some of that so that we can speak to, maybe more specifically to some of the things that everybody here is struggling with, or people here who know of other people who are struggling with it, because we'd like to address those things. So what types of symptoms or what types of inflammatory diseases are you concerned about tonight, or are you experiencing tonight? Can you please share that with us? Please let us know. Hi, Amy. Looks like Amy's joined. Catherine has joined. We've got a question about eczema. Is that caused by inflammation?
Yes. The end. Yeah, so eczema and psoriasis, so basically eczema on the outside, psoriasis on the inside, both of them are just dermatitis, which just means inflammation of the skin, and then there's a cause for that inflammation. And so for most people when it comes to eczema and psoriasis, it's like H2 or histamine 2 overflow from things like food sensitivities or molecular mimicry, and so it ends up, it's an autoimmune condition. All autoimmune is inflammatory, but more specifically, it's a T-cell dysregulation that has to be identified, and then when you eliminate those foods, then eczema goes away. So that's the easy way to get rid of the cause of that one. Otherwise, a lot of times they'll do steroids, which get rid of the inflammation through the 5-LOX pathway, or they'll do Elidil, which is a non-steroidal cream. Otherwise, they just eventually shut your immune system down, and you can't do that for very long. So that's a really problematic inflammatory condition that has to be rooted out as the cause, and then it should go away pretty fast.
How about Dave? Thank you for joining us tonight. His main concern is arterial inflammation.
Oh, yeah. So you don't have to worry about that because you're a guy, Dave. It's only women now. Or no, maybe it is guys. Is it guys still?
It's still guys.
All right, fine. So with arterial damage, so a lot of times with heart disease, we're told that cholesterol causes heart disease, but that's absolutely 100% not true. God does not make bad cholesterol to kill us. Otherwise, all mammals would be having heart attacks, and they don't. And then if you look at other people in other countries that make cholesterol, they have higher cholesterol, yet have 70% less heart attacks. So the real cause of all heart disease is actual inflammation. So there's inflammatory molecules like homocysteine, cardio-C-reactive protein, nicotinic acids, those kind of things. And when those kind of go around the body, they end up damaging the blood vessels. Especially, we talked about age or advanced glycolation end products. So people that eat like high glycemic foods, lots of sugars and juices, breads, they'll end up with these advanced glycolation end products that actually truly damage blood vessels, and then that's what causes a heart attack and stroke. So as the small, dense LDLs go to repair that damage so it can protect us, we just keep damaging, and it keeps repairing and repairing until eventually there's some buildup, and then we have lots of clots because we have inflammatory diets, and that clot then goes to that narrow part, gets stuck, and then you have a heart attack or stroke. Which, on the other side of that too, is just we eat a 40 times the inflammatory diet as we do anti-inflammatory. And if you look at just omega-6 rich foods versus omega-3 rich foods, then when you eat that corn-fed cow, corn-fed chicken, corn-fed fish, and then all the processed corn stuff too, versus the wild-caught, free-range, grass-fed, grass-finished meat, that inflammatory corn-fed omega-6 rich food then causes hypertension because it irritates the blood vessels. It causes arrhythmia of the heart because the heart runs off omega-3s, not omega-6s. And then it causes increase in platelet aggregation, which is the inflammatory part, which then causes clots, which then causes more heart attacks and strokes. And you're getting 40 times that heart disease risk than you are the anti-heart disease risk by eating lots of fish. So even with, you look at omega-3 rich foods, like a fish, really heavy fish diet, or the things that fish eat, which is fruits and vegetables and all that kind of stuff, then you have 9 separate mechanisms by which it reverses heart disease. And busting up clots and inflammation is a big part of that. That's my short answer.
Yeah.
So yeah, arteriosclerosis, arterial plaquing, cardiovascular damage. The markers that you want to look for that for inflammation are going to be things like homocysteine and cardio-CRP or high-sensitive CRP, and maybe LDH and ESR, but really those first two are your main ones to really look at to see, is there really cardiovascular inflammation going on? That's what you got to worry about.
So that is something you can ask your primary care physician to check?
Yeah.
Okay.
And they should, but they may not. I mean, basically, if you go through insurance, the only question is, will we get paid for it? Versus, what do you really need to know? And the other things, too, is like if you do a VAP cholesterol, that will actually tell you really what's going on in all the inflammatory parts. So when you look at IDLs or LPA or ApoB100, those are true, actual inflammatory processes going on from your genes to upregulate the repair process to cause more plaquing. But again, if those are elevated, then you still just do lifestyle stuff to get rid of it.
So, in terms of the vascular issues, we're really talking about not causing the damage that causes these repair patches, so to speak. If you need a visual, I like thinking of patches. If you've got too many patches on the inside of your vessels, those patches start building up.
You mean my cat
and that's
patches?
what we're trying to avoid.
My cat patches died of a heart attack.
You probably should have.
Are you making fun of my cat?
Mm-hmm.
Damn it.
So, check on these tests you can, or like Dr. Garrett said, you can work on lifestyle and start working towards prevention rather than treatment, and or both. Thanks for joining us. Who else do we have here? We've got some other people who've joined.
Oh, Beverly.
And we've got another question too. Beverly, hi Beverly.
Is that Amy from our mindful class?
Yeah, she asked the question earlier about the first
right.
question. Brianna does have another question. What impact does inflammation have on Alzheimer's or dementia?
Absolutely none. Wait, who has that? Where
Brianna.
are we?
Brianna.
All right. Okay, then it does. So Alzheimer's is basically characterized by amyloid plaquing and neurofibrillary tangles, which is messed up because I watched a movie last night, and it said the guy had it was Gunman with Chris Penn. No, Sean Penn. And does that matter? Oh, it doesn't matter. So in there, it showed a functional MRI of his brain, and it showed like amyloid plaquing. I don't think you can see that on an MRI because Alzheimer's is a post-mortem diagnosis. So amyloid plaquing, neurofibrillary tangles. Now, there is a big inflammatory component to that, but really, that has to do more with mercury. So there's a great video from the University of Calgary School of Medicine. I think it was 1990 that they did this, 92. But they showed an actual live study, cell culture study, where they put the amount of mercury you get from your dental fillings absorbed into your bloodstream, then go into the brain. They put that much, and you can see this brain nerve cell growing like this. And then as soon as they put that little teeny bit of mercury, it goes like this, and it dies. Right? And it leaves amyloid plaquing neurofibrillary tangles. So that inflammatory process is more of a toxicity effect. But when you look at things like dementia, that's you can have vascular dementia, which would be inflammation, right? So as we decrease blood flows to areas like memory, frontal lobe thinking, amygdaloid type of reactions, speech, all those kind of things, then you might have some dementia with that, or a change in your nerves for let's say output or sensory from the brain. But if it's neurological, that's inflammatory too. And so then if you just have nerve damage to those areas, then you're going to decrease input and output, which then can lead to dementia too. So the dementia can be neurological, it can be vascular, and then it can just be straight up toxic. So things like statins will cause that, but it didn't cause it through inflammation. It just shuts down the dolichol pathways and other stuff to shut down the cholesterol pathway.
It makes sense that if the body is a system and you have inflammation in your system, it's going to create damage anywhere in your body, right?
Yeah.
So,
And little bits is okay. It makes it stronger. Like if you break a bone, it'll get stronger than it was before. That's why I've broken almost all my bones. Now I'm stronger than ever.
So, okay, so we've talked about heart disease, we've talked about vascular issues, we've talked about autoimmunity.
Yeah, autoimmune big time.
We've talked about, what else have we talked about? Have we talked about joint pain? Anybody else got anything they're interested in? We do have another question here, a couple of things. One, Dave said he believes surgery caused his inflammation, and his doctor said he was just one who couldn't do surgery. And then we also have another question about, is the inability to lose weight a symptom of inflammation?
Yeah. So let's start with the easy one.
Okay.
Weight definitely can be inflammation. I can't tell you how many patients we've had that have changed their diet and their lifestyle to an anti-inflammatory one, and all that kind of swelling just goes down, and it looks like they lost a ton of weight, but they lost body mass, like bloating. But yeah, that's huge.
So maybe not necessarily a weight loss itself, but at least a size change.
Right, yeah. And then eventually weight too, but all those histamines, all those inflammatory, pro-inflammatory chemicals, all those prostaglandins that are inflammatory, cytokines, they basically create inflammation. So you think if I hurt my wrist, I fall down trying to unicycle down the rail, right? And I fall off and I break my really thick nerve glasses and my wrist, and I break my Pokemon watch and it comes right off, right? And then you cry for a little bit. But when you look up, you know inflammation creates swelling. So long, if you think about like kind of global inflammatory processes, then you're going to have global inflammation, and that'll increase weight because it's going to suck up more water for edema, and then that becomes an inflammatory-induced kind of chronic edema for those people.
Yeah.
So they'll lose weight when they get rid of the water part, too, and the inflammatory molecules.
Yeah, Sarah was just speaking about that, and she said raising her inflammation was bulking her up size and weight, but eliminating the inflammatory foods for her was her solution.
Yeah.
Is there any correlation with low sodium and inflammation? That's Christine asking. So she has lots of inflammation, she sweats a lot, and sometimes gets low sodium and has headaches.
Usually low sodium. I mean, the kidneys have like this thing called what's it called? Do you know?
Of course.
It's 18 million little filters, and they have what's called loop of Henle. That's what it is. So loop of Henle is this little loop, and it determines what ions can go in and out, and it'll actually make changes before it becomes urine. So the body constantly has this dynamic going on where it says, we need this, we need that, push-pull, 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 with electrolytes. And so for something really to be low, there's usually got to be something pretty messed up with that. And so a lot of times when it comes to things like sodium, potassium, most people are taking medications like hydrochlorothiazide or diuretics, or they're taking blood pressure medicines that kind of mess with that. And so that's usually where you see those things from. If someone profusely sweats all the time, that might be a big issue too. So loss of excess water very quickly might cause sodium loss, which then might cause cramping, all kinds of problems too. But I wouldn't do, just one of the things too about like cardiovascular is don't do low sodium, right? So stop eating processed crap. That's where 80% of all excess sodium comes from. But really, you need sodium. And so you want to put salt on things with what you do when you're cooking, but you don't want to eat things that'll never go bad, that'll just have way too much salt in there. Especially if it's low fat, low carb. There tend to be a lot more salt in those to try to get the brain addiction part with processed food. So, is that the answer? Is that a good answer?
Sure.
All right, so if I didn't answer that right, let me know. But basically, you probably want to, they'll tell you don't drink water maybe with the sodium thing, but just add more sodium to your food that you cook and drink plenty of water and make sure you're not taking meds that cause that problem.
So, before we kind of get into, we're kind of halfway through here, and at some point we're starting to get questions about what's the solution, what's the remedy, and we will get to that tonight. But so we've talked about some types of inflammatory processes, symptoms, diseases, heart disease, autoimmune, irritable. We didn't really talk much about irritable bowel, but we've got irritable bowel, fibromyalgia, migraines, all of these.
You have grains?
And so my question to you is, we've talked a little bit about what's causing the inflammation, but do you have any ideas about what might be causing it? Tell us, just start throwing them out there, what you think causes inflammation. So people and doctors sometimes cause inflammation. Dr. Pepper is a good one. So, throw that out there. Tell us. Give us a list.
Don't drink Mr. Pibb because he didn't even have the gumption to stick it out like Dr. Pepper did.
Okay, Trish says wheat and dairy. Yes. Stress.
Huge.
Processed foods from Brianna. Stress.
Yeah.
Dairy from Sarah. Yes. Stress, definitely. We probably should have talked. We should talk a little bit on stress, because that seems to be the first thing that's coming to a lot of people's minds. There is a chemical process that occurs with stress, and we've talked about that in previous shows about you can either eat a candy bar or stress a candy bar. That also gives you another clue as to something else that might cause inflammation. A really big one. See if you can.
Candy bar?
I gave out a clue. Yes. Anybody know what the really big one is? There it is, sugar.
Ah, damn it.
So sugar.
I was this close to guessing.
Dairy, wheat, stress. What else do we have?
Basically, just being American.
Living in America.
The American lifestyle.
Alcohol. Got alcohol.
Is he offering alcohol or she?
We might take you up on that
All
offer
right.
if that's...
Red wine doesn't, but the rest are just soda with, they're like adult sodas. That's all they are. But red wine would be anti-inflammatory.
So, we've got some good suggestions. Would you like to add anything else, Dr. G?
Oh, disrupted gut bacteria. So you have
The
small
gut?
bowel, yeah, back to poop.
Okay, he's looking for a way to get that into the talk.
Poop.
Sounds legitimate. So, digestive imbalance, would you call that?
Yeah, so like overgrowth of good bacteria or overgrowth of bad bacteria.
Okay.
Yeah.
So sugar, digestion, stress, we could say diet, really, because we've talked about...
Yeah, omega-6 versus omega-3 foods. Or inflammatory foods.
So an overabundance of omega-6s.
Yeah.
Right? What else? How about sleep? Lack of sleep.
Ooh, I had to look that up because I was like, how does sleep cause inflammation? Or lack of sleep?
Lack of sleep.
But it goes back to the stress part. And stress releases biochemicals that are inflammatory.
Yes.
Yeah.
Yes.
It's always simple. And you know what's messed up is they did this study where they took a dog. They had a room, had two sides, right? So you had floor A and floor B, and they electrified both floors with two different switches, right? And then they had this dog in there, and when they would flip on floor A, the dog would become electrified, and then it would mosey on over to floor B. So if they shut off floor A, turned on floor B, guess what happened?
You can go back to the other side.
Right? So our natural tendency is to choose happiness, right? But what if they turned on both floors?
To avoid pain.
Yeah, that too. Yeah?
Okay.
So what if they turned on both floors?
Terror for the dog.
In the beginning. But what eventually would happen?
Desensitization.
Yeah, the dog would just get used to it. The dog would slowly be shocked all the time to the point where that just becomes normal, and the dog would fall asleep and wake up and eat food and act like that's normal. And that's what most of us do when it comes to like psychological stress, emotional stress, is we just get used to this chronic inflammatory process, and it just becomes our new normal. So if you talk to people that are like, yeah, I get headaches, but you know, everybody gets headaches. Yeah, sometimes my stomach hurts every day at lunch, but that's normal.
Yeah, and then those things build up over time, and before you know it, you've got several processes going on, or several symptoms and issues and diseases, and and you've just gotten used to it. That's a pretty powerful analogy.
I think
it's a horrible story, though.
It's very powerful. I know we don't do those experiments, I think, on animals anymore. I think.
So.
We should do that one on like a kid.
How about on no one?
Like a sassy kid that screams at Walmart. Be like, I got an experiment for you, buddy. Yeah?
Right. We should just do medical testing on all those children.
That's right. We should go around to all those screaming kids. You've been chosen.
They go into a lottery. It'll be just like the Hunger Games.
Hunger Games.
There you go.
We could call it the stress games. And we could study the inflammatory process that happens with these children. And the parents will all be happy because the children are gone. So they'll be on vacation, and then they'll come back and the kid will be all like One Who Flew Over the Cuckoo Nest kind of situation. No?
Okay, so we have talked about types of inflammation and the fact that inflammation is not always bad. That's a myth. So we do have to look at it from a balanced perspective. But it seems as though we have an overabundance of it, yes?
That's right. Yeah.
So we do still need to reduce inflammation in general. We just talked about causes. So you guys can have those in mind. And now I'm thinking it might be good to think about or talk about remedies. Are any of you already doing anything? And if you are, please tell us what you're doing. Tell us what you're trying. Tell us what you're having good results from.
Yeah.
So type that in, or tell us what you think might be helpful, even if it's over-the-counter type stuff.
Yeah. Okay, so over-the-counter stuff?
Enzymes.
Oh, yeah. So one of the things that happens with chronic inflammation is you put down fibrous tissue, fibrin, to basically limit range of motion to prevent damage or part of the healing process. So digestive enzymes that are proteolytic, they actually will go through and digest that scar tissue and basically free up joints and undo that long inflammatory process.
But they need to be proteolytic, correct?
Yeah. Dun, 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 dun. There we go. Yeah, proteolytic enzymes. So bromelain, papain, lumbricase, nattokinase, serratiopeptidase, protendinase. Just kidding, that's made up. But those are good. And if you take them in between meals, then they work at knocking down inflammation through the fibrolytic part of that. But so does fish oil does that too.
Enzymes will not only break down scar tissue, they will also help clear the arteries, correct?
By doing that, yeah.
Yeah.
And so most countries, this isn't much of as big of an issue because when they eat food that's anti-plaquing, it goes through and scrubs out those arteries, so then they can have inflammation, damage, repair. Inflammation, damage, repair. Whereas Americans, it's inflammation, damage, 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 heart attack.
Mm-hmm.
So that's really important. What else?
Other solutions, other remedies. Anybody else have any thoughts? We've kind of given you some hints too during this talk.
I know you guys know about one. That's a very, very, very good one. It's essential oil, and they gave Jesus it. They gave Jesus it.
They gave it to Jesus?
They gave it to Jesus.
Okay.
Like, here you go, Jesus. Have some of this oil.
We've got another one. Dave, fish oil. Can you talk about fish oil?
Yeah.
Okay. While we wait on our answer.
All right, so fish oil, there's 3 pathways, like this, 3 doorways that lead to pain.
You look like you're throwing out gang signs.
What's up, East Side? All right.
Okay, so 3 pathways.
I'm going to get shot.
Yeah.
All right, so 3 pathways to pain and inflammation. So we have chronic insult or damage. That leads to arachidonic acid, and then arachidonic acid uses COX-1, COX-2, and 5-LOX pathway. So think of like 3 doors to get pain and inflammation to the rest of the body. If you block those doors, then you can block pain and inflammation. And so the first door is what's called COX-1, or cyclooxygenase 1. And that pathway is what we use willow bark to block, which then became aspirin, which then became ibuprofen.
Okay, so how does that relate to fish oil?
I'm getting there. What, do you want at the end of the movie already?
Your movie could be 3 hours long. That's my only concern.
All right, fine.
Okay.
There's that one, then that one. And then we have the third pathway. And the third pathway is the 5-LOX, or 5-lipid oxidase pathway. That one is what we use steroids to block, but steroids then cause people to balloon up and become diabetic, or it destroys the joint that we're trying to knock inflammation out of. So the other thing that then regulates that 5-LOX pathway is fish oils. Is that better? The short version? All right. And fish oils...
Why does fish oil work?
Because it's a 5-LOX inhibitor.
Right. Okay.
Well, what?
And it's also an omega-3?
Yeah.
Okay.
Yeah, you know, omega-3s.
Omega-3. If you have questions about dosage on fish oil, or even the enzymes or anything like this, type those questions in. Dr. Garrett will answer those, maybe not tonight, but soon.
Yeah, if you have questions we don't answer, just post them, and I'll go back through all these.
So fish oil, you told me one time fish oil was just as good as ibuprofen or better.
Yes. So 1 serving of fatty fish, cold water fatty fish, is just as effective as 1 full-strength ibuprofen, 325 milligrams, for getting rid of pain and inflammation. So if we don't eat the inflammatory diet, we have less inflammation. And then if we eat the anti-inflammatory diet, then we just get rid of inflammation, and then we barely ever have inflammatory problems. And so fish is a huge part of that.
Okay.
Yeah, but not like lake fish. Ocean
A certain
fish.
kind of fish, wild-caught fish.
Salmon, tuna, halibut, mackerel, cod, sardines.
Brianna's asking, so would fish oil positively impact skin conditions caused by inflammation?
Yeah. Yeah, so you just take the fish oil and you rub it all over your skin, make a lotion out of it, and then you lose all your friends. But you attract a lot of birds, so then you can have bird friends.
There's that.
Yeah.
Bird friends.
You should probably eat it, though. I bet eating the fish oil would be better.
Once again, 50% believe 50% of what he tells you. Work really hard to trust your intuition as to whether or not he's telling you the truth.
Yeah.
So.
If this ever goes to court, I'll just be like, I was just kidding. So, yeah, taking fish oils. So, at 1,000 milligrams of EPA plus DHA is therapeutic against inflammation. 3,000 is even better. But again, not what's on the front of the label. So it always say 1,000 milligrams of fish oil. But you want to look on the back of how many omega-3s are in there, or add up EPA plus DHA. So if you go to Walmart and get fish oils, it'll be like 300 milligrams of actual omega-3s. But if you get like Nordic Naturals or Carlson's or something like that, it'll be like 1,000 to 1,400 just from one serving. And so that is therapeutic dose.
Yeah.
That's what you want.
What do a couple of other people throw out? Green tea and sleep as solutions.
Yeah.
You want to talk a little bit about green tea?
So green tea has lots of anti-inflammatory. I always think green tea, red wine, those are true medicines against inflammation, especially cardiovascular inflammation. So green tea not only has theophylline and epigalic acid and theanine, so it makes you smarter. It actually regulates your genes, not your blue genes, but your actual DNA genes. And so it'll actually turn on and off switches, so it's epigenetic. But it actually knocks down a lot of inflammation. Studies that came out of China, which seem biased, right? I mean, that's like having jerk studies from America, especially the South. So those studies from Zhejiang University in China, I feel like I'm all over the place. Is that the feeling you get that feeling?
No comment.
The studies from Zhejiang University, which I'm not 100% confident that's how you say it, because I was educated in Texas. So they showed that drinking 1 cup of green tea was as effective as 1 ibuprofen, or sorry, that one was 81 milligram of aspirin for getting rid or preventing inflammatory heart disease. Sorry. Does that make sense? So 1 cup. And the new studies that came out a few years ago said that women who are more likely to have a heart attack than men, because they have to be number 1, right? That 3 to 5 cups of green tea can cut that risk by 50%. It's not a big deal, but 50%. Is that a big deal? It doesn't seem like a big deal, you know? Not black tea, because black tea is oxidized green tea. But green tea is antioxidant, anti-inflammatory.
Okay.
Well, what?
So.
You don't seem impressed by that. You're a woman. That's curing, like, the number 1 disease for your whole gender. That you should be crying a little bit. Like, that's great news.
I wonder if you want me to be impressed because of the news or just because of the fact that you delivered it. That's just my thought.
I feel like that was a baby, and I delivered that baby, and then you were like, whatever, just click, 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 right? And that baby was going to save half the women's race in America. In America!
It's exciting. Okay, so enzymes, fish oil, green tea, sleep.
Sleep. Oh yeah, so sleep. Yeah. 'Cause lack of sleep.
What about kombucha?
Kombucha's the best.
Oh, well, let's go back to sleep really quick, though, because we kind of skipped that.
Okay.
So, sleep ideally 7 to 8 hours per night, yes?
Mm-hmm. Yeah. That's
Pretty
right.
cut and dry. That's one.
Because he's snoring all the time.
That's one solution. Or maybe valerian root. Or maybe yogi bedtime tea.
Yes.
Or maybe exercising to make yourself naturally tired at the end of the night.
Yeah, so some people exercising before bed makes them go to sleep because they're burning off all the stress and
Well, I wouldn't exercise right before sleep.
No, I'm just telling you, some people that are like high stress, that exercise actually sedates them. It burns off the epinephrine.
Okay.
But a lot of people then, if they exercise, they actually increase epinephrine, they can't go to sleep. So it might be a little different for different people.
So exercise some point during the day that works for you
Mm-hmm.
might actually help you go to sleep more easily.
Yeah.
So sleep, and then we had, what else did we have? Kombucha.
Kombucha.
What
So
do we
kombucha
think?
would be fermented green tea, yeah. And the fermented, yeah.
So that falls in the green tea category.
Yeah, in the 20 different acids that are made by kombucha regulate the bacterial growth within the intestines. And so basically with that, you're also then going to make more B vitamins, but knock down inflammation through regulating the small bowel bacteria.
Okay.
And large bowel too. Yeah.
Okay. Back on sleep, we had a question. 10 to 12 hours of sleep, is that bad?
If it's a problem, it is. So yeah, depending on age determines kind of a little bit of difference of how you sleep, or how long you sleep. Babies sleep more, old people tend to sleep more, and then young, vibrant people like me that are the right exact age tend to not even need sleep. No, 8 hours. Yeah, you know how Americans are. We want 8 hours for everybody across the board. I wake my babies up if they slept more than 8 hours. I'm like, this is not good for you!
So Dave's wondering just how much red wine you've had tonight, Matt.
What? Therapeutic
Thanks
amounts.
for asking, Dave. Thanks.
This is all without drugs or alcohol. That's the crazy
Do
part.
you see what I have to go through?
You should see me at a party with 3 Heinekens in me. Then things get a little crazy.
So we've had several great suggestions for solutions. What are we missing from our solution toolkit?
So big time with herbs.
Do you want to herbs?
Yeah.
Do you want to talk a little bit about the other COX inhibitors? The COX.
I tried to tell that story, but no one wanted to hear the whole story.
Well,
they just wanted the end.
We had a question about fish oil, which I thought could have been addressed directly.
Okay. So to block COX-1 enzyme, use willow bark, but you really don't want to do that long term. Once in a while, that's fine.
So willow bark is an option.
It is, but it's not a very good option for very much.
Okay.
So because that one will actually decrease mucus, which then increases your risk of acid burning through the side of your stomach and then pouring out, burning a hole, and then you start screaming and the acid starts flying over. So that doesn't turn out very good. So more people will die of bleeding disorders from that than so there's a risk there.
A very realistic risk of shooting out acid out of your stomach like a fire hose.
No, but with the
Very
bleeding
realistic.
disorder, because COX-1's also block thromboxane, so you can't clot off that bleeding that you just caused in the GI.
Okay.
So for every 10,000 people that thinning blood saves, 14,000 people would die from it, from the side effects. So.
Okay, so moderately willow bark. What else?
And so those aren't very safe. So you want to really do COX-2. And COX-2, which is like Vioxx, Mobic, Celebrex, those cause heart attacks because they actually affect the endothelial lining of the cardiovascular system. So the natural ones like turmeric and ginger, or curcuminoids, those are the most powerful anti-inflammatories for cardiovascular, and they block pain and inflammation through the COX-2 enzyme.
Yeah. I was having joint pain, and it's kind of like a marker. It feels like it's my marker for inflammation, right? When my joints and my hands start hurting, I know I'm inflamed. So I experimented with the turmeric and ginger tea, just grating it directly into the tea, and had immediate results within the day. So
yeah. Do you know the lemon ginger?
Yes.
You
can tell them about it if you like.
You go ahead.
Oh no, I'm going to let you. It's your favorite.
Heart attacks and conversations, ladies first.
Oh no, go for it.
All right, fine. So if you get one whole You don't know the recipe, do you? Mm-hmm.
Yeah, you do like you do like this much ginger, and you do a whole lemon, and you grind it all up, and you make a paste, and you keep the paste somewhere, and you just dip out the paste into your cup.
Okay.
I've heard it 100,000 times.
Okay, so what you do is you take a whole lemon and cut it up with a little bit of water, blend it up, take the ginger, chop it up, and put a little water in there, make a paste, and that ginger lemon paste is a very powerful anti-inflammatory, and then you put it in the fridge in a mason jar, and then you scoop about a tablespoon to 2 tablespoons in a big glass thing of water, and then you drink that every day or twice a day, and knocks down tons of inflammation and pain.
Yep.
And you can put a little dash of turmeric in there if you wanted to, or put a lot of turmeric. And that's what turmeric and coconut milk mixed together before bed. That's also a really good pain reliever, and it knocks down inflammation.
There's one pain reliever we have not talked about, and it is your number one.
Cocaine. Meth. Those are opioids.
It's always about the drug references.
Hey, that's right.
Every talk. So...
opioids are real.
So he gave you a hint earlier. Maybe you can type it in. It was the oil that was given to Jesus. So the story goes that was the oil that was given to Jesus. So.
Or Jesus, as we like to call him sometimes.
Can anybody type that in for us?
I'll give you the other two things. He got gold. I think they were chains, and so when he walked, it was like Jesus, like that. And then they gave him myrrh, which is an antibiotic.
There it is. Frankincense.
Brianna got it.
Yep.
So yeah, frankincense oil is a very powerful inflammatory, or anti-inflammatory. And it's because of the boswellia, or boswellic acids that are in there, that knock down pain and inflammation. And that's actually a COX-2 and 5 lipoxidase pathway blocker. So it blocks 2 out of the 3 doors, which means you get a lot of anti-inflammatory without causing bleeding disorders.
Hi, Newman. Thank you for your likes and your hearts. We like your heart.
Uh-oh.
Oh.
It's like 4th of July.
We hope you're feeling well.
So then there's other herbs. So we talked about ginger and lemon, but you could also do things like basil is an anti-inflammatory. It's also an antibiotic. Cardamom seed, what's the kind that Mumbai railed the rice? It was Jeera? Is it Jeera rice?
It's basmati rice, but that's not the herb.
I know, but that's the name of it. I finally asked him. He said it was because it has cardamom in it. So in Indian, it's, I think, Jeera. So cardamom, which is good in rice.
Cardamom.
In Texas. And then cayenne.
I'm not only the boss, I'm the dialect coach.
That's right. I majored in science, not English.
Yeah.
So I don't know. So cayenne. So cayenne's really good. It has you know what it is? Capsaicin. So cayenne or spicy things have capsaicin in them, and those block pain and inflammation too. Okay. Not through the COX-1, COX-2, and 5 blocks, but by overstimulation of the C fibers, I believe.
Really, I feel like if you choose Indian food, you can't go wrong. You're going to have a really good Indian food. You're going to have at least 5 of these pain relievers in them.
She likes your food, Newman.
That's Native American cuisine.
I like to just call them Americans.
So Indian food, the kind with all the spices and the rice, is what I'm referring to.
So what about cilantro? Cilantro, cloves. Cloves is a really good pain reliever. So I had a friend, she's died now from cloves, but I had a friend and she had burnt her hand and she was crying and crying and she's like, "Oh, help me, Dr. G." And she was just crying. And so I told her to put clove oil on her hand. She burnt it, I think, with an iron because they were doing some reenacting of Good Times and she was Janet Jackson or something. That's really not funny. Okay. Nobody's going to get that reference anyways. So, she had burnt her hand. Oh, it's hot water that she burnt it on. And it burnt so badly. It was second-degree burn. And so I told her, get cloves and grind them up and make a paste and put it on there, and the pain will go away. So then she texted me like, I don't know, an hour later, and she said, I'm full of crap. That didn't work. And so then I texted her back and say, put more on. More on, right? And then she got 8 cloves of garlic, ground them up into a paste, or her husband did because he's a good husband. And then she put it on, and then like within 2 seconds, it went away, and she stopped crying. Does that make me a hero? I don't know, but probably yeah. I didn't even get a text back with that. It was just like I had to find out later what happened.
Because most genuine heroes like to tell their story and get attention.
She said I was full of crap.
Genuine heroes really like to get attention from their stories.
Why do you think they wear all the fancy capes and stuff? I like to blend in. All right, so clove oil is the bomb. Now, I use that on my daughters, and it actually burns a little bit before it numbs. But the Journal of Dentistry said that clove oil is just as effective as benzocaine for numbing out pain for dental procedures.
So that's another very good one. And that's not the only one. There are several more foods, spices, and essential oils that are good. And we can speak to some of these, or we can list some of these out. We probably won't get all of them. But we had a couple of other, Sarah was saying black pepper and nutmeg too. Dave is also mentioning garlic or cloves, which you just mentioned cloves.
Yeah, and garlic too.
Garlic too.
Very powerful antibiotic, but also a pain reliever. Although if you chew it raw, it causes pain. Oregano and parsley, rosemary.
Sometimes I like to just have a clove of garlic in my mouth to kind of like a lozenge. Like to just kind of hang out with a little bit.
If I don't like a conversation going on, I put a little bit and chew it. Like, how interesting! Like that. Is that what you did?
Exactly. That's exactly what I do.
Get a bunch of garlic and then yell at your kids. Like, and you.
So, as far as anti-inflammatory foods go, I know there are some of you watching who have heard this, heard our phrasing for this. Anybody who can throw that out there for us gets our accolades.
Undying respect.
And undying respect tonight. If you can throw the anti-inflammatory foods out, it's a big long acronym. And go.
Dun, 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 dun. Can you do the Jeopardy thing?
I'm not going to do the Jeopardy thing. It's too cliche.
They're not going to get it. Brianna will get it.
I'll give you a start. Fruits.
No. And these are
I'll give you the first one.
Anti-inflammatory foods.
Whole foods, not processed. Brianna,
I told you.
fruits, nuts, seeds, legumes, greens.
Yeah. Berries, maybe. But
Stop giving them away.
What? Well, I don't always say the berries part. I say fruits, vegetables, nuts, seeds, berries. Oh, I do. Ooh.
It's a wonder that I'm even here to plan. Like, sometimes I wonder. Okay, so is that all of them? Fruits, nuts, seeds, legumes, greens, berries.
I don't even think you know it. Fruits, vegetables, nuts, seeds, berries, legumes, greens. But also in this category would be...
Berries are a fruit. She's right. She's right. And greens could theoretically be a veggie. We didn't get veggie in there. But we sort of single those out. Beans are legumes. Yes. Yeah, Diane.
Yeah.
So, but you get the general idea.
Yeah. I
do. Fruits, berries. Yeah. Vegetables, greens.
Yeah.
Nuts, seeds, legumes.
And then cold-pressed anti-inflammatory oils. And if you think about this, so think about all those herbs that we talked about. And I can post those for you. And then you talk about all the foods that are anti-inflammatory. And if you take those foods and you cook them with those spices and herbs, then you get a very potent anti-inflammatory